Welcome to the Holeless Talk, where we treat the whole person and not a hole in a person. This is Dr. Khwaja, and today we're going to go over the Dutch Plus hormone testing. As usual, whenever you receive a kit, I encourage that you open up and empty the entire contents of the package and put them all like this out on the table. And always go to the instructions sheet. This is the instructions document over here. And I always recommend that you always read the document at least 3 times. The first time you probably are clueless, the second time you're a little more aware, and the third time is always a charm. So always read the instructions 3 times so that you're clear what it requires. Then the second thing you should go towards is the requisition form, which is basically, in other words, the order of the test. And this tells the company what we are requesting them to do on the patient. So always read the requisition, and typically we check which test is being done. In this case, we're doing the Dutch Plus with the Corso Viking response curve. So we've checked that out, and it has our information. And the rest of the form is basically you fill out your name, date of birth, height, weight, your address, your contact information. If you're taking any medicines, you can write that. And of course, over here, you're writing down the time and date of the collection of your samples. And of course, in the second page, it also asks you more questions about some symptoms, and you fill them out to the best of your judgment and your understanding. And finish it, and of course, it'll go inside the box. So for right now, we will actually presume that we have filled out the form, and we're going to actually put that inside the kit box. All right. And of course, this is the mailer, and I always recommend you always see which carrier it is. In this case, it is UPS, and if you look at it, it says second day air, which means if you say, for example, ship it out on Monday, it'll arrive there on Wednesday. If you ship it out on Tuesday, it'll arrive there on Thursday. Wednesday, it'll arrive there on Friday. But if you ship it out on Thursday, it'll arrive there on Saturday. I always discourage that never ship it out on a day that it arrives there over the weekend, because there's no way to receive it, and then your effort may go to waste. So always ship in such a way that it is received by the company on a weekday. In our practice, we always give you the exact date when you should be shipping it out. So that is something you don't have to worry about. I'm going to put these on the side. And of course, these are the collection tools that we have. So we will start taking them out and set them aside. And in this case, I recommend that you get to a table and just spread them out just like we're doing that right now. And for the collection instruction, it tells you exactly how to put them on the table, like how to collect them. And in this case, they're all color coded, so I'm going to put them in a color coded fashion over here. So you start off the day. So I'm going to put that like this. So basically, you wake up in the morning, say at these are two of the saliva collection containers, and of course these are for the urine. As you can see, all of these require you to put your name, the date of collection, the time of collection, on everything. Your name, date, and time of collection. So you put them on the table like this, all color coded based upon sample number 1, 2, 3, 4, 5, 6, and overnight. So when you wake up in the morning, for example, if you wake up at say 5 o'clock in the morning, within 5 minutes of waking up, you're going to actually take this tube. You'll see that there's a sponge-like material inside. You will put this in your mouth, minimum 2 minutes, maximum 5, and it'll absorb the saliva from your mouth. So you basically, once you've absorbed the saliva, you put this back in this, and then you actually put in the freezer. And make sure that you put your name, date, and time of collection. For example, you wake up at 5 o'clock, collected by 5:05, it should have been collected. And then, of course, you get up, go to the bathroom, you urinate, and then dip this in the urine. This is the blotting paper. It'll absorb the urine, and then you open up like this and allow it to dry for 24 hours. And this, meanwhile, will be going into a freezer. Then after 30 minutes of waking up, for example, you woke up at 5 o'clock, at 5:30, you're going to collect the second saliva sample. Again, you'll see the sponge-like material inside. You'll put it in your mouth, minimum 2 minutes, maximum 5. And once it's collected, you write the date and time of collection, and then you put it again in the freezer. Then you go collect the third sample, which is at 1 hour after waking up, which means you woke up at 5:30 was the second sample. By 6 o'clock, you will collect the third sample. This is saliva sample. Again, you put the sponge-like material inside your mouth, minimum 2 minutes, maximum 5, and then you put that in the freezer, put your name and date and time of collection. Then, after 2-3 hours of waking up, for example, by 9 or 10 o'clock, you are going to actually go and again get another urine sample, urinate in a cup, and then you dip this blotting paper and it'll absorb the urine and allow it to dry for 24 hours. Then around 4 to 5 o'clock, again you collect another saliva sample. You put this sponge-like material in your mouth, minimum 2 minutes, maximum 5. Write your name, date and time of collection, and put in the freezer. And then, of course, you go to the bathroom, collect urine sample, dip this in the urine, and allow this to dry for 24 hours. And, of course, around before going to sleep, like 10 to 12 midnight, you get the sixth sample. Again, put the sponge in your mouth for minimum 2 minutes, maximum 5. Put in the freezer, write your name, date and time of collection. And, of course, you will collect another urine sample, dip it in the urine, and allow this to dry for 24 hours. And of course, if you wake up overnight, you will get another sample of saliva. And then again, freeze it. So this way, you will have collected 1, 2, 3, 4, 5, 6 saliva samples and 4 urine samples. And once they've been collected, they are dry 100% for 24 hours. You're going to basically close them. Make sure that you've written the date and time of collection on all the samples. And as you're collecting the samples, you can see that on this requisition form, there was a place where you're supposed to write the date and time of all the collection of the samples. So you write them down over here also. And as these are now dry, you're going to seal them, close them like this. Put them back inside this plastic Ziploc bag. Seal it, and then this will go over here, the one tube which is overnight separate, and the rest of the tubes will go back in this Ziploc bag, all frozen. And the day you're ready to ship it out, you're going to actually take out this frozen tubes, and you're going to actually put them again, the requisition form. We'll put all these tubes in here, and we're going to actually close this, and this will go inside this like this, and we're going to seal it, and then it's ready to be shipped. And a little instruction about menstruating women: you should always collect it from day 19 to day 22 of your menstrual cycle. And for menopausal women, you can collect any day. Of course, you're not menstruating. And for men also, you can collect any day. For longer or shorter cycles, basically, you will be given instructions specially based upon what your needs are. And we will specify that to you in our office. Thank you so much, and hope this helps.